In the US, if you are a Black patient, you are more likely to not have insurance. You're more likely to be treated at a hospital which has less resources. When a cancer patient first steps in the door, the care that they're likely to receive is of lower quality than the care that a white patient might receive. Hi, my name is Shawn Johnson. I am currently a medical student at Harvard Medical School in Boston, Massachusetts. I've learned a lot from talking to Black cancer patients, and especially talking to Black women with breast cancer, is how much of sometimes a struggle it is to have their voices heard. And what I found, and again, what I think has really made me fall in love with this work, is how many patients have a story of a time that something happened in the medical system and in the medical setting that really hurt them, and that they've carried with them anything from months to years to decades. And you can actually find this if you look at a lot of papers. You will never find the word racism a lot of times. This is something that I think a lot of people in medicine are very uncomfortable talking about. There's been this constant relationship between the medical establishment and minority populations that was really exploitative and harmful for centuries. We know this is true all the way from the case of physicians purchasing slaves during the colonial slave trade. Patients were often tricked into participating in research. It's a very, very difficult and dark history. We treat people differently based on their background, and we see that persistently when we look at the interactions that Black patients and Black cancer patients have with providers. We see that providers spend less time with them, they're less likely to make physical contact, to sort of do reassuring gestures in the exam room. It's another barrier in thinking about being heard. It was really astounding to me with the number of Black women who say either had a lump or they felt a lump on a self-exam and were effectively written off by their provider. And we're told that either Black women don't get breast cancer this early, or we're told that women just in general don't get breast cancer this early. Sort of these like myths and ideas of a biologic difference between Black women and white women, which are very much a hallmark of racism in the US. Having these open conversations about medical racism and this history in an open and transparent way with Black cancer patients and Black cancer patient advocates, it engenders trust oftentimes. Having that open conversation, I think, sort of shows that we're willing to deal with the past and the really, really terrible job that we've done historically, and take account of that, and now move forward in a way with Black cancer patients that is equitable and that is safe and is inclusive and that is for the benefit of our community rather than the exploitation of our community.